I am extremely excited to introduce you to OptimaCare 360 and our product offering OC3 Insights. What does quality healthcare mean to you? Many people would define it as access to the most highly trained physicians, access to the greatest teaching hospital in your region, access to high-end technology and diagnostic procedures and pharmaceuticals. And I would argue that those are all false definitions of quality. In contrast, we at OptimaCare 360 believe that quality is defined in healthcare as consistency and predictability. We would in fact argue that we have a very low quality healthcare system under those definitions because we have a very highly variable treatment process. One could argue that we have as many different healthcare delivery systems as we do physicians, because every physician is a healthcare system unto themselves. So in the behavioral health world, dedication, commitment, compassion, and training are not sufficient to guarantee consistency in patient experiences. In fact, in behavioral health, we have an extremely variable way of delivering care, even within the same organization. That's why we created OC3 Insights. What OC3 Insights does is brings a consistency and a level of commitment to clinical excellence that is missing in our industry. So what are the components of OC3 Insights? Well, first, we provide foundational clinical education and understanding of best practices delivered in a concise, easy to digest format that includes continuing education credits for our clinical resources. These include DSM modules that define best practices for a diagnostic related situation. And more importantly, it provides the values that a clinician needs to embrace relative to collaboration, biopsychosocial model of care, other kinds of dimensions of care that contribute to better outcomes of the patients. So we provide this educational foundation. Secondly, we provide a structured experience for patients. We provide templates for group therapy, including general behavioral health, IOP, PHP, and other group therapy interventions that provide a consistency for all patients undergoing the same treatment pathway. And these curricula are supported by psychoeducation modules that are in video format that provide a consistent foundational format for patients to digest. So this ensures a consistent patient experience as well. These modules are designed not only for use in group therapy sessions, but also can be used for individualized pathways to recovery and addressing behavioral health dysfunction. A third component of the OC3 Insights product is the systematic and organized delivery of clinical management structure and processes. We want our clinicians and our systems to come with a sense of humility that I can always improve in what I'm doing, and to be receptive to direction, supervision, clinical case conferences, peer review, and development plans that provide an impetus for continued pursuit of clinical excellence. And finally, we have all of our services and products here wrapped around an advanced technology platform that ensures that we can monitor and manage the consumption of clinical education modules, as well as the dissemination of education modules for patients on their treatment plans. These can all be white labeled and integrated within an existing EMR or other technology platform that the health center happens to have at their fingertips. So the result is a pursuit of excellence and ensuring that patients and clinicians all are delivering and receiving the same high level of care in a consistent way that improves patient outcomes. So when patients are engaged in a better way, dropout rates will reduce, no-show rates will reduce, and the result is a very positive impact on the bottom line. As well, having consistent formats for clinical protocol and group therapy curriculum will provide the therapist with confidence of delivering excellent care and reduce their level of stress and burnout. That also will benefit the facility in being able to deliver a much better financial performance because of reduced turnover. So if you are ready to move forward and improve the consistency of evidence-based excellence in therapeutic intervention and patient outcomes, come join us. We would love to help and support your effort and mission toward pursuit of and normalizing the clinical excellence in the delivery of services.